All funerals for COVID-19 related deaths to be held within 72 hours of certification of death. Details of this story and more in the National Report. Welcome back. With the details to the news for Monday, September 20th, 2021, I am Sherry Noel. Effective Wednesday, September 22nd, protocols agreed upon by the government of Grenada, religious leaders and funeral directors will be implemented to prevent the spread of COVID-19. The measures were outlined by Acting Director of Medical Services Dr. Taisha Donald during a joint press conference on Monday. She said since August 2021, the rate of infection has increased and community spread of the virus is much more pervasive, along with the increase in deaths. The measures were drawn up to compassionately and respectfully discharge responsibility to the departed and their families.
All burials from deaths due to COVID-19 will be done within 72 hours from the time of the certification of death. 2. Persons dying from COVID-19 infection will not be embalmed. 3. Up to 2 persons will be allowed to view the body at the funeral home for identification purposes only. After the body is identified, the coffin or casket will be permanently sealed. 4. Graves will be dug to a depth no fewer than 6 feet. 5. Families will have the option to cremate or to bury. 6. Accommodations will be made for religious bodies requiring special rites in the preparation of bodies for burial. 7. Funerals will remain between the hours of 9 to 12 a.m. However, where there are more bodies to be buried in a given day that can be realistically done within these hours, permission can be sought from the Royal Grenada Police Force to extend the time no later than 2 p.m. And 8. Funerals will take place only at the cemetery.
Clinton Bailey, who represented the funeral agencies at Monday's press briefing, assured that all 3 funeral homes on the mainland are now properly equipped to deal with the bodies of COVID-19 victims.
Myself, Lacqua, and Wayne, as everybody know, Lacqua had to bring in a refrigerated container, which is necessary. I brought in one, which is necessary, and Wayne have some storage that he told me today he's up and running with capacity. So we are all in a good place now to handle whatever comes to us.
The funeral directors have also agreed that 2 family members will be given the opportunity to view the remains of loved ones to verify that the body to be sealed in the casket is that of their loved one. Moving along, more than 1,500 people were vaccinated over the weekend at mobile and pop-up clinics that targeted various parts of the island over in the second of the 2 no-movement weekends. Details in this report by Leslie Ann Johnson.
Doctors, nurses, volunteers and others were out in full force again over the weekend as they continue to wage war against COVID-19. Teams targeted St. Andrew, St. David, St. John and St. Mark, St. Patrick and St. George over the 2-day period, taking every effort to protect lives. The Government Information Service visited the St. Paul's Sports and Community Centre, which had an impressive turnout. Acting Director of Medical Services at the General Hospital, Dr. Taisha Donald, who is originally from that area, is a driving force behind the initiative. Following discussion with Parliamentary Representative the Honourable Gregory Bowen and the St. Paul's Sports, Cultural and Development Organisation, the clinic was organised and received overwhelming support.
Based on what's happening now, I think persons are beginning to realize that, hey, it is real. Vaccinations do help because, as I've said in other forums, the majority of persons who have died from coronavirus in Grenada, in our hospital, have been the persons who are unvaccinated. And I think this message has been out there, and I think persons have now made a conscious effort to decide, hey, let me do this. Let me get vaccinated. Let me help protect myself and my loved ones. So I think the message is getting out.
Parliamentary Representative for St. George Southeast, Honourable Gregory Bowen, was happy that all their hard work paid off. He commended the many volunteers and the St. Paul's Sports, Cultural and Development Organization for the partnership, saying this is what happens when everyone works together for the good of the country. He was even happier to see some of the people who were reluctant in the beginning show up to take the vaccine.
They must be emissaries now and ambassadors to go out and tell the others who were like they were before, indicating that they're not too sure and they're here, so ensure that everybody's sure and come out and take the vaccine now.
Brian Pifford, chairperson of the St. Paul's Sports, Cultural and Development Organization, told GIS that they want organizations similar to his to get on board and help stop the spread of the virus.
The only way we could handle the situation is for everybody to come together and fight it. Everybody needs to do what is necessary and try not to get a virus, right? So our role, as I said, as an organization in the community, we see it fit to engage the Ministry of Health and to try to get our community together in order to go through this process.
GIS also caught up with Minister for Health and Social Security, the Honorable Nicholas Steele, who was at the vaccination clinic at Foodland Car Park, Kirani James Boulevard, both Saturday and Sunday. He described this as one of the more successful weekends. And with news of at least one death in Carriacou, Minister Steele is appealing to others to arm themselves the best way possible to guard against the virus.
We are suffering a fate that almost every other nation in the world has, and the solution is the same for every nation in the world: to vaccinate as quickly as possible its population so that we can protect as best as possible our population.
Thank you, Leslie Ann. This is the National Report. More news after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. The government of Grenada, through the Ministry of Health, has reached out to the international community for assistance as challenges have arisen within the health sector due to the increased numbers of positive COVID-19 cases on island. Grenada's Health Minister, Honorable Nicholas Steele, made the statement when he appeared on the Monday Morning Perspective program with moderator Brenda Batiste and panelists Christopher Diali and Byron Campbell. Minister Steele says, based on what the science is showing and in anticipation of increased numbers in hospitalization and an already stretched health sector, government has taken the necessary steps to ensure the provision of essential health services in dealing with the COVID-19 cases and other health-related issues.
Today we have two teams coming in to assist. One team from Mexico, doctors and nurse practitioners that will give support and easement to our ICU team, our hospital team in general. And another team led by one of our proud and patriotic Grenadians, Dr. Philip Bonaparte. He's coming down with the team as well to lend support. And we have others coming in. SGU has tapped into their alumni, and they will be coming in so that they will be giving easement at all different levels and support to our medical team that has been on the front lines and bearing the brunt of this to date.
The past few weeks, Honorable Steele says, have clearly painted a picture of what can happen when we do not adhere to protocols and in some cases delay a decision that can be in our best interest. He says, however, with change in attitude, a positive outcome can be achieved.
The actions that we take in society is what prevents or delays or slows the hospitalizations and the deaths. I've said before, and I think what I need your help with, all three of you getting out there and explaining the phrase and coining the phrase, so to speak, is that community behaviors and habits have to change to control community spread, and then in the future, to prevent community spread from coming again, community behaviors have to change. It's not about quarantine and borders, etc. and so, no. It's around us all over. And when it does rear its ugly head, however it rears its ugly head, we need to make sure that the community behaviors have changed so that it doesn't spread like wildfire throughout the community.
And finally in the news, 99-year-old Leah Guadalupe, a resident of Top Hill Senior Citizens Home in Carriacou, is the island's first COVID-19 related death. Leah, who is also known as Fatina Guadalupe, was one of 11 residents of the home to have tested positive for the dreaded COVID-19 virus. She succumbed at the Princess Royal Hospital on Sunday, September 19th. Minister for Carriacou and Petite Martinique Affairs, Honorable Kindra Maturin-Stewart, says Fatina was well known on the island and made her due contribution in so many ways.
It is with profound sadness and grief that I extend my sincerest condolences and sympathies to the family and friends of the late Miss Leah Guadalupe, also known as Fatina Guadalupe, affectionately called Cousin Fatina or Tan Faith.
Honorable Maturin-Stewart made a clarion call for residents on the Sister Isle to get vaccinated, as there are now 2 residents hospitalized at the Princess Royal Hospital.
It is in fact a deadly and serious disease, and so I want to implore upon every one of us to continue to fight and to continue to do all that we can to safeguard ourselves, our families, our friends, and especially the vulnerable among us. We have to continue to do what we have to do to protect ourselves. And so I want to urge again the need for vaccination and the need to follow all the protocols.
And with that story, come to the end of the National Report for Monday, September 20th, 2021. On behalf of the entire news and production team, I am Sharian Noel, thanking you for viewing.